Okay, I'm here with one of my sons for the head to toe assessment, Tyson. He's gonna help me with this today for the video. And we'll start in standing position, and let's do some Romberg, and just trying to do some balance. So we're gonna do balance. So Tyson, go ahead and just cross your arms and just sit there. And all right, now close your eyes. Excellent. No dizziness or awkwardness or losing his balance at this time. That's good. All right, you can extend your arms out. Excellent. Go ahead and touch your nose. Alternate hands. Okay, that's good. Go ahead and balance on one leg, balance on the other. Good. Usually do this in younger adults. Okay, and then walk a little bit for your gait, and then turn around, walk back. Very good. All right.
Excuse me.
Now walk on your heels a little bit. You can just stay right there. Okay, good. Walk on the balls of your feet. Okay, good. Now let's do, while you're standing here, let's do a scoliosis test. So you can turn and then kind of touch your toes slowly. And you want to be checking for any abnormalities of the spine, off of normal. And then you can also, while you're here, check the spinous processes for any pain or tenderness. Do you have any pain or tenderness? No. Okay, excellent. Go ahead and come back up. All right, now you can go ahead and have a seat. And we'll start to go over the cranial nerves. I'm going to raise you up a little bit. So we'll start with number 1, which is smell. So close your eyes and plug a nostril. Tell me what you smell. Lemon, very good. Then do the other one. Very good, excellent. Now, at this point I would, if I had a proper speculum and stuff, you could do the nose for that and inspect, but then you're looking for the turbinates and drainage or septal deviation, stuff like that. And then you would place it in the nose so that you could really look, but I don't have the right attachment, so I can't do that now. So, but that's looking good. The eyes were done earlier, vital signs. So then we'll go to cranial nerve 3, 4, and 6, which is continuing the kind of the eyes. So we'll do the ocular motion, extraocular motion. So focus on this pen, and we'll just move it and follow it with your eyes only. Don't turn your head. Very good. What you want to do is kind of get out in the peripheral, because that's where that would happen if there was an eye problem. So that's good. And then, oh, I didn't do accommodating. I almost forgot. All right, focus there. Okay, very good. Now, I'll turn off the lights and we'll check his eyes because we're here. Go ahead and just close your eyes. Now open. Good. Close again. Open. Now, equal, reactive, constricting, they all look good. All right, that was 3, 4, and 6. Now we'll go 5, 7, which is kind of his facial area here. So go ahead and close your eyes again. Tell me if you can feel me touching your face. Good, and then open your mouth and your jaw, and we check for TMJ syndrome. Very good. And go ahead and smile. Frown. Very good. Wrinkle your forehead. Lift your eyebrows. Very good. All right. Then we'll go to number 8, which is his ears. And I already have this set up because I prepared. And really, we could do this like, close your eyes for me, and then tell me if you can hear me whispering. Okay. Close your eyes. Okay, that's good. And then we're going to check the ears and the tympanic membrane. So then we would go into the ears, pull it back, And you know, you're looking for irritation. The membrane tympanic looks good, grayish color, clear. You know, a little bit of cerumen and wax, but nothing major. That's normal. So then we'll check this one as well. There you go. Oh, that looks good. Okay. Excellent. So there's that. Well, that's his hearing. Then we do 9, 10, and 12. And I didn't bring one in, but we'll just pretend I have one, okay? So I need you to open your mouth, stick your tongue out, and go ahead and lift up a little bit. Good. And then move your tongue side to side. Excellent. And then open wide and say, ah. Okay, that looks good. And while you're here, you might as well check the pharynx, the tongue, the teeth, the gums, and do a good mouth examination to make sure there's nothing going on there that's out of the ordinary, and it all looks good. All right. That was 9, 10, 12. Number 11, if you can shrug your shoulders for me. Okay, very good. And then turn your head side to side, and then go ahead and push pressure on my hands with your head. Very good. And this side a little bit. Good. Very nice. Okay, so while you're here, one thing that I want to implement is, oh, and I forgot one other thing, but it's called stereography. I can't ever say it, but basically close your eyes, and I knew I'd forgotten something. Come to my hand. Okay, tell me what this is when I put it in your hand. Very good. Now on this hand, I'm going to draw something and you tell me what it is.
Triangle.
Very good. Oh, so bad. That was just to finish off that neuro exam a little bit. Okay. All right. Now, while you're here, what I want to do is kind of test your muscles and stuff and working my way up and down and all around. So what I want you to do is take your hands like this, put them together, and kind of move them up and down like this. Okay, that looks good. All right. Now, what I'm doing is testing the upper extremities, and I'll work my way to the lower extremities. Now, I want you to put your hands like this, and I want you to push out. Good. So we're looking at external rotation, and then push in, internal rotation. Okay, now put your hands up, and I want you to push me. Good. And then I want you to pull me. Good. And then squeeze my fingers. Good. Don't crush them. All right. Very good. Now with your legs, flexion and extension, go ahead and lift it up. Okay, that's good. And then this one, up and down. Very good. All right. Now what I want you to do is let's test this would be the abduction. So push out. Good. Good. And you're looking for pain and tenderness through all these movements. That's good. All right, very good. And then go ahead and push out. Good. Pull back. Good. All right, now dorsiflex the feet for me. Very good. Very good. I'm going to lift you up a little higher. Go ahead and lift them up again. And push for me. And pull back. Good. Okay. So this way we've kind of tested all the muscles, which is nice. And so then what I want to do is, while you're down here, you can also, I'm going to lift you up a little more. And I'm kind of debating, but I think I'll do some deep tendon reflexes with my hammer. So while I'm here, you can do this on the Achilles. So you find the Achilles, and then, you know, sometimes you may not want to hit it directly, but you can, but you're looking for those reflexes. Okay. And then the patella one is right here. Very good. And he's dead here.
He reflexes
There we
that.
go. Okay. Now, I'll work my way up a little bit. And so you have the radialis that you can check on either side, and that's the muscle that runs here. and you just kind of touch it a little bit there, and it will flex the hand. And then the bicep sits here, another deep tendon, and so then you want to press it there, but you don't want to hit it too hard, and so you kind of hit it on yourself. Anyways, that's what you kind of do to kind of flex those. So let's see, did I get all those? Oh, and the tricep is where you just let it relax here, and then you're going to tap it on the back of where the tricep inserts on the lateral side. Very good. Excellent. All right. Now, another thing you can do while you're here is you can check through the pedal pulses, and you can do that by putting your fingers here. And you can do this laying down as well, but I kind of thought work my way up until I can get to this other parts. Now you can also do the Achilles pulse and stuff as well. And then the popliteal you can do. And they're kind of harder to find, but once you find them, you can feel the pulse. Very good. And then one thing that's good to do is you can also check a Hohmann sign. So kind of bring the dorsiflex or pull your foot back. Any pain in your calf? Okay. You know, while you're down here, okay, relax. And another thing you can do when you distract them is what you want to do is kind of move their leg and then really push up when they're not expecting it. And you're looking for that clonus sign. So then we're working up, and then the femoral, you can check the femoral vein, artery in here, obviously. And we'll keep his decency for that one. And then the radial, you can assess the radial. Excellent. And then go ahead and sit up straight for me. And then here you want to check them one at a time. You don't want to check them twice because you might have your patient pass out. So you're looking for that carotid, and it's usually right here in front of that sternocleido. There it is. And take my hand off. Very nice. Okay, so then we've kind of gone through everything, and then now we can go to his neck and the carotid. Now, when you're listening for bruits, you want to use the bell, but if you got a fancy stethoscope, it's got the bell in it. So then what you want to do is have them hold their breath so you can hear it. And then check the other side. Good. And at the same time you're doing all this, you're looking for uniform with his throat. And so you want to watch his thyroid right here. And then can you swallow for me? Good. And then you're looking for any deviations or looking for goiters or abnormalities. So the other thing you can do, and technically you should come behind them, so lean forward a little bit. And when you come behind them, you can kind of feel and kind of deviate it a little bit and make sure that everything is lined up properly. And I don't want to get too aggressive, but then you're just making sure everything is aligned and in proper order. Okay, that does that. Now let's do we'll do the thorax and the chest next. So what you want to do here, go ahead and sign the slide forward for me a little. All right, I'm going to lower you down just a little bit. All right. So then you want to listen, and when you do this, you can implement a couple strategies, because if you're looking for fluid on the lungs or pneumonia or any of that stuff, yeah, you want to listen, but you can tell your client to whisper pedicordically. I can't ever say it. And so then you whisper 1, 2, 3, and then take deep breaths as well. So, and then say 1, 2, 3. Okay. And another. Very good. And then systematically you cover the chest as you go down, or the back, or the thorax and the lungs. Another thing you can do is bronchophony, which is 99. So just say 99 while you do breaths for me.
99.
Mm-hmm.
99.
Good. And these should sound muffled. And if they sound clear, then you know you
99.
have a problem. Okay. Now, what I want you to do next is do E. E. Very good. Keep taking breaths for me.
E. E.
Very nice.
E.
Good.
E.
Good. And then you can get the bases on the sides. Excellent. There you go. Excellent. And then right here. Excellent. Another breath. So they sound clear to auscultation. Now another thing that you can do when you're doing this assessment, and you can decide based off position, is the CVA aspect, which is the costovertebral angle. Now that angle is felt at the 12th rib and the spine. And so when you find that spot, you can put your hand on it, and then you kind of percuss and see if they have any pain of any kind or tenderness. And what that does is that's your kidneys. And so you're checking if there's any inflammation or problems with your kidneys. You didn't have any pain there, did you? Good, thank goodness. All right, and so that's kind of that whole side. Now you can also come to the front and you can check all of this. Now another thing you can do is you can percuss along, and find all of your landmarks on the back, and especially your bony prominences, which are usually dull, but then those areas that you're trying to use, and that's a higher skill for sure. Same thing on the abdomen when we get there, but I'm jumping the gun. So you can check the front as well for the lungs, but it's really better to check the back. And so you can have them breathe here, and that's good, and here. And then really what we're going to do is we're going to do the aortic and the heart at this point. So we're going to do all 5 positions. And so you come down and it's like the second, and this is the aortic. Very good. And then the second one is the pulmonary, and then you go to Erb's point. Good. And then tricuspid. Very good. Listening to the heart. And then mitral, which is your apical pulse. And yeah, that's a good one. And of course, you're looking for anything out of the ordinary there. But those are your 5 sites that you're assessing. Now what we'll do is we'll move to the abdomen and we'll lay him down. So go ahead and lay, but you can slide back. And we'll lay him down. And while you're doing all this, you want to make sure you're watching for everything. And during the exam, and you're looking for abnormalities. So other things like when I was up here on his head and maybe in his hair and scalp, and just kind of general inspection is always good. You're looking for anything out of the ordinary, lumps, masses. Obviously when we go through the assessment, tenderness and all that. So, all right, so here, lift your feet. You can get a little more comfortable. That's nice, huh? You're gonna go to sleep. All right. So with the abdomen, inspection, and then you want to listen. So we're going to listen to all 4 quads for bowel sounds. And sometimes it can take longer, and so just for the fact that we don't want to be here all day, but usually you can hear the gurgling and whatnot going on, and that's good. Yeah, I can hear it. Okay. Yeah, very good. So then you can go to your after you've listened, then you can do like you can do percussion and palpation and deep palpation. Now, like I said before, percussion is kind of, you know, you can start here, but another thing you can look for when you're percussing or about to is right here, you can listen for an abnormal or the aorta bruit, which is kind of hard to hear. I mean, you hope you don't have to hear one, but if you do, okay. And then it's, you know, percussion is kind of it's a very good skill. And I'm not going to say that I'm very good at it, but you can find your landmarks and your rib cage and everything, and you're looking for that different type of resonance as you do it. And you can go all over, but remember that if you do find any type of pain or tenderness, you don't want to palpate or continue. So then you're going to palpate in probably about 9 different spots and cover all different areas looking for tenderness and stuff. So that's kind of what we're doing here. And then right over here, you have the edge of your liver, and over here would be the spleen. And so in order to feel that they're relaxed, you kind of have to palpate a little deeper. So if you can kind of suck your stomach in a little bit, that can kind of help. And sometimes you can feel the edge over here for the liver as it sits right in this area. And then over here at the spleen, it's kind of similar, but that's what you're trying to figure out and locate. Any tenderness or pain there? Okay, good. And then that is basically the abdomen that you're looking for. Now, another thing you can do, McBurney's point, you can have some rebound tenderness, you know, for appendicitis, stuff like that, that you're kind of looking for as you go through the assessment. And so I think I covered everything that I can remember. So there you go. Thank you for your time, Chris.